Good afternoon, everyone. This is Saro Arakelians, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on drug medication news, update, and education. So, what is BITE therapy? BITE therapy is basically bispecific T cell engager therapy. It's a type of immunotherapy that uses specially designed antibodies to link a patient's own T cells directly to the cancer cells, essentially forcing the immune system to recognize and destroy the cancerous cells by bringing them into the close proximity. So that's BITE therapy. This therapy is considered a targeted approach. It targets the cancer cells to cancer treatment that leverages the body's natural immune response to fight cancer. Antibodies have two binding sites usually. One that attaches a specific protein on the cancer cell, and another that binds to the CD3 protein on a T cell, effectively bringing the two cells together to trigger the T cell's cytotoxic activity against the cancer cells. In the last few years, in the US, the FDA has approved BITE therapy to treat several cancers after other treatments have failed. Some of these BITE therapies include B cell for cancers such as B cell lymphoblastic leukemia, CD19 positive Philadelphia chromosome negative B cell precursor acute lymphoblastic leukemia, diffuse large B cell lymphoma, follicular lymphoma, melanoma, multiple melanoma, and small cell lung cancer. In October 2022, US FDA approved the first bispecific T cell engager or BITE therapy for patients with relapsed or refractory multiple myeloma. The drug as is known as teclistamab or Tecvayli is given via subcutaneous injection under the skin for patients who previously received four or more prior lines of therapy. Then in August 2023, a year later, FDA approved two more biotherapies, talquetamab or Talvi, and enraltanab or Elrexfio for patients with relapsed or refractory multiple myeloma patients who have received at least four prior lines of therapy. These therapies are both are given via subcutaneous injection. So in this video, I want to summarize what is BITE therapy. When you hear the BITE therapy for cancer, it's basically bispecific T cell engager therapy. It uses your body's immune response by itself and attaches with two binding sites to the cancer cells, which one attaches the specific protein on the cancer cells, and another binds to the CD3 protein on a T cell. And this is how it attaches itself to the cancer cells. And in the last few years, and there have been more indications for biotherapy, such as for B cell lymphoblastic leukemia, diffuse large B cell lymphoma, myeloma, multiple myeloma, follicular lymphoma, small cell lung cancer. In October 2022, as I mentioned, there was the first biotherapy approved, which was Tecvayli, as a subcutaneous injection for treatment of relapsed or refractory multiple myeloma. In my previous videos, I explained what's relapsed and refractory multiple myelomas. You can refer to that video to find out what that is. Also in August 2023, FDA approved another biotherapy, which was the Talve and Elrexfio. And these two again are subcutaneous injections, and these were for relapsed or refractory multiple myeloma patients who have received at least four prior lines of therapies and have failed these therapies. So again, this is biotherapy is going to be one of the new therapy options for cancer patients for the treatment prognosis. For more detailed information on this type of therapy for cancer, make sure to subscribe to the channel. Ask your questions on the comments, and I'll be happy to answer any questions you may have on biotherapy. Hope you enjoyed this video. As always, stay safe and take your medications.